MUSIC stands for the Michigan Urological Surgery Improvement Collaborative. MUSIC is a statewide quality collaborative in the state of Michigan that is supported by Blue Cross Blue Shield of Michigan. As a group of practices, we have around 46 practices throughout the state that encompasses over 260 urologists. And our goal is to improve the care provided to patients with urologic disease.
MUSIC has grown tremendously since its inception in 2011. Not only have we grown our membership to now include 90% of the urologists in the state of Michigan, as well as 15 patient advocates that provide critical input into all of our quality improvement initiatives, but we've also grown in terms of the urologic diseases in which we focus. We originally were focused specifically on prostate cancer care. In the last several years, we've expanded into looking at patients with kidney stone surgery and those with small renal mass diagnoses.
We are a collaborative that's been set up together to try and refine process of care so that every patient in the state of Michigan, no matter which practice that they enter, they will get the same high-value quality care.
MUSIC holds 3 collaborative-wide meetings a year where we get together with urologists, practice administrators, and data abstractors from each of our participating groups. And we share updates on what the coordinating center has been working on recently and what our upcoming priorities are. And we also are able to get a lot of feedback from our participants, which I think is the most important part of those meetings.
And only by truly having patients be part of the conversation with the provider community are you actually going to be able to address some of the long-standing challenges that we've seen in the delivery of healthcare.
My first experience was rather intimidating. I was in a session with approximately 50 to 75 doctors and medical professionals. The people that were conducting the meetings got me involved. They solicited opinions where it was helpful and areas where I could contribute.
One thing that truly resonates with me is the impact that our patient advocates have on the Michigan Urological Surgery Improvement Collaborative. They provide guidance, significant input. They tell us what the patient truly wants. And I think that has made MUSIC all the more successful.
MUSIC is making the patient experience better in 2 ways. One is the upfront education that the patient will receive through pamphlets and consultations with their doctors. And the second is exploring options that are available for treatment, which will give the best possible outcome for the patient.
You know, I've had feedback from providers throughout the state. What they like about MUSIC is that MUSIC provides them some level of guidance, some level of uniformity where they feel that everyone is trying to do the same thing to advance patient care.
I am so proud of my involvement with MUSIC. It has really been one of the most satisfying aspects of my medical career. It has just been such a blessing for my patients, for me, for my team. The ability to interact with colleagues, the ability to learn from one another, the opportunity we have to see what our results are, to compare them with other sites and have that opportunity to be challenged.
What I like most about being a MUSIC member is that it makes me feel proud and confident to know that I belong to a collaborative made up of passionate, collegial, and forward-thinking urologists and administrators with the goal to provide the best quality of urological care for our patients. MUSIC urologists are working together to provide the best urological care by critically analyzing and then implementing changes that are data-driven based on the collaborative's findings on various aspects of care that ultimately improve the quality, value, and outcomes of the treatments we provide for our patients.
The clinical registry is really the heart of the MUSIC program. It's an online registry where our participating practices enter data about their patients. And then the coordinating center takes that data and uses it to analyze practice patterns across the state, as well as identify opportunities for improvement and keep track of our progress on our current initiatives.
MUSIC has a wealth of information on their website, and that's like a one-stop shop. And patients are able to go to that website and they're just able to participate more in their care and they educate themselves in their care. And when patients are educated in their care, they respond better.
Some of the key successes in MUSIC include the reduction of prostate biopsy-related infectious hospitalizations. We also have seen a significant increase in the use of active surveillance and thus the avoidance of unnecessary definitive treatment for patients with lower risk prostate cancer. We've also seen a significant decrease in the use of unnecessary imaging for patients with low risk prostate cancer. We have a robust electronic infrastructure for capturing, measuring, and improving patient-reported outcomes. That's for patients that are undergoing prostate cancer surgery as well as kidney stone surgery. Some of our more recent successes have included the establishment of pain control optimization pathways that have resulted in a dramatic decrease in the use of opioids for patients undergoing prostate cancer surgery and kidney stone surgery. We have also seen a significant decrease in the emergency department visits for patients undergoing kidney stone surgery. For patients with small renal mass diagnoses, we've established a virtual tumor board in which more than 50 urologists from across the state review complex patient cases, provide expert opinions so that they can establish the best pathway forward and treatment protocol for that particular patient.
So it's been 10 years, we've set up the collaborative. I think the tips of that have been that we have an inclusive culture, we're a diverse group, and I'm proud to say that we've made some real impact in the state of Michigan. Our goal now is to see, can we expand that impact beyond the state of Michigan? So as a result of that, we developed a new initiative called Outdoor Music, where we are now having some sites outside the state of Michigan join our collaborative and see if we can work with them to also improve care in other parts of the United States.
What excites me most about the future of music is that the sky is truly the limit. The collaboration between the Music Coordinating Center, the physicians and staff throughout the state, and Blue Cross Blue Shield of Michigan is truly unique, and I think will continue to have a significant impact on improving patient care for many years to come.